Hello everyone, my name is Dr. Sienna Miller. I'm a naturopathic physician specializing in dermatology. This video today is part of an acne series that I'm making for YouTube. I'm going to be doing several videos all related to acne and then do that for various different conditions. So today I'm going to be talking about the most common gut issues or GI, like stool test findings that I see in patients with acne. And this is not only based on my clinical experience, but also some research that has been done on the topic. So I'm going to start with the microbiome. I see the microbiome going a couple of ways. Some stool tests, we see just not enough good bacteria. So across the board, a general theme of low levels of beneficial or commensal bacteria. And, this causes other issues. It can lead to leaky gut, inflammation, overgrowth of other pathogens, just because there's more room for things to grow. On the other side of things, I'll see overgrowth, which can be an indication of things like SIBO, which is small intestine bacterial overgrowth. In my experience, it's kind of been about equal of what I see. So it can go either way, which is why I don't always recommend probiotics to every person, because sometimes we see overgrowth and not a lack of good bacteria. So those are some things I see as far as the microbiome goes. Next is overgrowth of opportunistic microbes. So opportunistic microbes are not necessarily pathogens, but they're not beneficial to us either, and they're not necessarily an issue if they're in the gut until they start to overgrow. So a study was done on a cohort of, I think, about 36 patients with acne. And the findings were that 94% of them had Candida overgrowth in the gut, which Candida is a type of yeast. Extremely common, not only in acne patients, but also various skin diseases across the board. I see this all the time. It's such a common finding, and I'm able to get a lot of success with my acne patients by treating Candida. And sometimes Candida is not the only yeast that's present. I'll find other species of yeast as well. And mold is another common finding that we see kind of in the fungal category. Next in that study, 92% of patients had H. pylori present in the gut. Not necessarily an active H. pylori infection, but at least the presence of H. pylori, which H. pylori is a bacteria that hangs out in the stomach, and it produces urease to lower your stomach acid to allow it to survive better. And that causes issues with digestion. It causes problems with sterility of your gut, because stomach acid's not only important for digestion, but it also kills a lot of things that we're ingesting throughout the day that our bodies, we don't want in our gut. So when you start to have low stomach acid, we're not digesting, absorbing our food as well. Low stomach acid is associated with various other conditions, and then microbes and pathogens that are not supposed to be getting into our bodies can get in through the gut when your stomach acid isn't high enough. So if H. pylori is present at all, I like to target it with acne, even if it's not a full-blown infection, just because it's so common in patients with acne and other skin diseases as well. And treating it can really help to reduce symptoms of acne. And then the third common overgrowth seen in this study was that 53% of patients with acne had protozoal overgrowth, which protozoa are a category of parasites. You can have like worms or protozoa. So, and those often go hand in hand with H. pylori, potentially due to low stomach acid. The third most common thing I see is issues with secretory IgA, which is part of your gut mucosal immune system. Either secretory IgA will be really high, which tells us about more acute inflammation, just general inflammation going on in the gut. On the other spectrum, secretory IgA can go really low, which just means your body has stopped, or your gut immune system has stopped mounting as efficient or effective as an immune response in your gut. And usually that's due to chronic inflammation. And that's a really strong sign of leaky gut. The high secretory IgA can be a sign as well, but definitely, and we definitely want to focus on reducing inflammation, but especially when that is low, leaky gut is probably going on. So we're doing a lot of gut healing and, cleaning up overgrowth, trying to reduce inflammation, things like that to bring that down. All right, and those are the most common findings I see on gut testing in my acne patients. Again, everybody's so different, and I see all sorts of findings. Those just happen to be the most common based on my clinical experience and research. But again, it's really important to have testing done for each individual, because sometimes I don't find those things, and sometimes there's other things that I didn't just talk about that we're finding. So it's important to test for everybody. But those are the most common findings. I think it's so fascinating, especially the Candida and H. pylori overgrowth. Over 90% of acne patients have those things. And it's just, it's crazy to me that those are not just first line tests for patients with acne, because you know, we can treat those, and I have treated those and seen significant improvement in acne. So it's really, yeah, I just want to make this video so if you're struggling with acne, you're aware that there are these underlying causes and things that we see that we can address and that are relatively easy to identify and address, and through treatment get significant improvement, if not resolution, of acne. All right, well, I hope you enjoyed this video. If you want to see more videos like this, don't forget to subscribe to my channel. Give it a like if you enjoyed. Let me know if you have any questions down in the comments, and I will see you in my next video. Have a great day.